The information shared on the Sky Women's Health podcast is for educational and informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding your medical condition. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast. Reliance on any information provided by Sky Women's Health, Dr. Carolyn Moyers, or any guests featured on the podcast is solely at your own risk. You're listening to Sky Women's Health Podcast, your evidence-based resource for women's health and wellness, exploring the holistic principles of osteopathy, integrating mind, body, and spirit, designed to empower you as your own healthcare advocate and help you live your best life. I'm your host, board-certified OBGYN, Dr. Carolyn Moyers. Welcome, Sky Women. Welcome back to another episode of Sky Women's Health Podcast. We are talking all about perimenopause today, and this is often misdiagnosed. Often patients feel like they are losing their mind. They don't feel themselves anymore. They don't know what's going on. They're running around from this specialist to that specialist trying to figure it out. They've seen their PCP and got their labs done, and they say, it's normal, you're fine. And the patient is like, looking around confused, like, I don't feel fine. And sometimes they leave in tears feeling dismissed. How do I know this? This happens every day. And sometimes women are struggling for years. And we know that perimenopause can last 7 to 10 years before that final menstrual period. So this is not a short phase of life. This is a decade we're looking at, ladies. And we need to be prepared. We learned about puberty, but who told us about what's happening in menopause? No one. So I'm so glad that we're having this conversation today, and you're in for a treat because I have Dr. Knuppenburg, who is a family medicine physician in Florida. So if you are in the state of Florida and you are needing whole body care, she is the founder of WHOLEBODY MD and has a specialty practice specifically for women called Eden. She is a board certified family medicine physician focusing on women and menopause transition. Welcome, Dr. Knuppenburg.
Thank you, Dr. Moyers. I am so honored to be here. And, like you said, to talk about something I see so often in my practice, women wondering what on earth is happening to their bodies and their minds in their 30s, 40s, 50s, and beyond. As a family medicine physician, I began to notice a real common theme. So many women in midlife struggling with symptoms that were dismissed as stress, aging, or, just part of life. And candidly, I have been on the same hormonal roller coaster myself from
Like, I am
pregnancy.
you. I'm with you.
Yeah, pregnancy, postpartum, heading right into perimenopause. So I know firsthand as well what it's like. And ladies, like, we are all in this together.
Yes, absolutely. And like you, we were talking before starting recording, I opened my practice thinking that women deserve better in the healthcare system. And I think I deserve better too in the healthcare system than, come on, you're not productive enough. You need to see 40 patients, but yet you can barely get the documentation done or have the quality conversations that you need to have to really get to know and help the patients. But in opening my doors, I thought that my osteopathic skill set was going to be my niche, but it turns out that the perimenopause and menopausal women came flooding like, oh my God, you have time to listen to me. You're not going to be running about delivering a baby. And you said you had a similar episode where, opening your practice, here come the women. And I love that women now are demanding quality care. They are like, we're not taking this sitting down. This is not mama's generation of menopause. We need answers. We want to thrive, not just survive, and it is a confusing time in life because you are busy with raising children. You may be fatigued from, will we ever sleep again? I'm not quite sure. And then aging parents, you may be at the height of your career. There are so many things going on that it's easy to just brush it under and pretend like this is all going to be okay. We're going to get past this, right?
Absolutely, like all of the above that you just mentioned, and that's it. Like perimenopause is this transitional phase leading up to menopause where our hormone levels, right, are just fluctuating daily.
Yeah, the hormone levels are erratic in perimenopause. This is a very important point that I want to make sure that we state. There is no lab value, there is no hormonal value that is going to define being perimenopause. So if somebody is selling you a swab to, swab your cheek and get a saliva sample for your hormones and it's going to cost you several $100s, run in the other direction. It's BS. Now, do we get labs to rule out other underlying causes that could be masquerading as perimenopause? Yes, we do. So it's almost a diagnosis of exclusion. It's like what we call a clinical diagnosis, where you and your clinician are working through, is this perimenopause or is this a thyroid disorder or, insulin resistance or something else that could be presenting, which I know you see all the time.
Yes, exactly. And you're right. Like those are very common issues that step into, my office daily. And it's not as apparent as the typical symptoms, right? The typical common symptoms.
Yeah. Okay. So let's talk about common symptoms and then the uncommon symptoms.
Yeah, so most women enter perimenopause in their 40s, but it can begin as early as the mid 30s. So these hormonal shifts, primarily the decline in estrogen and progesterone, can cause a wide range of symptoms. Most women expect hot flashes and night sweats, and those are definitely common. Some other symptoms that I see in my office are irregular periods, maybe shorter, longer, heavier, lighter cycles, or
Very
even just
common.
unpredictable.
Yep.
Yes,
Oftentimes the first
exactly. Yes. And also, furthermore, mood swings, a lot of irritability. I hear a lot of rage, and patients, women feel a lot more emotional or reactive than usual. And moreover, some sleep disturbances, the classic, and I'm sure you probably heard this in your office as well, but waking up at 3 a.m. and not being able to fall back asleep. Right.
it is universal. It doesn't matter what time zone you're in. It's 3 a.m.
Exactly. Exactly.
I mean, it's
Yeah,
something. Yeah. And
it
with
is.
it's really is this vicious cycle, because if you can't sleep, then you're over caffeinating and your metabolism is not working as well, right? And you are more irritable, more easily overwhelmed, more agitated, more depressed mood. And then but you can't get back to sleep, It's just this vicious cycle. So yeah, I mean, all of those symptoms, sleep disturbance, weight gain and weight redistribution, the brain fog, the migraines, dizziness, inner ear itching is an uncommon one that we, don't hear as often, or people say dry skin, itchy skin,
Yes.
and they don't
Mhm.
think that correlates. Heart palpitations is one that we see a lot, and they usually, get an EKG, they go to the cardiologist. They're like, they said nothing was wrong. And with a
Yes.
little hormone therapy, it goes away.
Exactly.
Yeah, the
Yeah.
fatigue is a big one, vaginal dryness, low
Mhm.
libido, painful sex. I feel like a lot of women also say that they feel like, they have adult onset ADHD. And is it fatigue? Is it the low mood? Is it the many things that they're juggling? Is it ADHD? Or is it just this brain fog, this lack of being able to concentrate?
I agree. I think like once a patient steps into my office and they say they pretty much normalize brain fog, as a joke. But I already know that's a clear indicator.
Yeah.
Let me ask more hormone related questions and see what other symptoms correlate. But I agree, brain fog, trouble concentrating, forgetfulness. A lot of patients say they walk into their kitchen, open their fridge, and they don't know what they went in there for. So it's really common. Like you mentioned, some symptoms also fly under the radar. So some of the not so common but completely real symptoms include joint pain and frozen shoulder. One of my patients this morning, I've been seeing her since January. Her chief complaint at that initial visit was right-sided frozen shoulder. And she was started on the estradiol patch and micronized progesterone. And over a few months this morning, she did not even mention her frozen shoulder pain. And I I
forgot
said,
about
"This
it.
is so exactly." And she says, "Oh yeah, I forgot about it." So it's amazing, just very vague symptoms, but they're completely valid and real, right? Like you mentioned, too, heart palpitations is so common, and then also new onset migraines or worsening of existing ones I've seen. Tinnitus, ringing of the ears. And I'd love to know your take on this, but I even get like changes in body odor or allergies. Like never had allergies, right? But all of a sudden,
Yes.
it's so weird, but so true.
Yes, actually, that's very true. Just thinking about a couple of cases, to kind of bring that home. I had a patient who started on hormone therapy, was doing great, and then she came in and said, all of a sudden, I've developed an peanut allergy. And after she left
Hmm.
the office, I went, oh my God, she's on micronized progesterone. I've got to pull her off because that
Yes,
has peanut oil in
exactly.
it. So we've got to
Ex-
change your form of progesterone. So I think that, to that point, it's really important that you have a menopause provider, someone who is really well versed in the hormone therapy options, because if you've only got a few options in your toolbox, it feels really limiting, right? And if your provider doesn't know what to do with that, they may just pull you off of your hormone therapy altogether, God forbid,
oh my
when it's a
goodness.
simple adjustment, like let's try a different formulation that might be better for you.
Yeah, and you're yeah, because you need someone to connect all the dots, right? Because these aren't the classic signs or symptoms. So you need someone trained or someone who has a large panel of midlife women. Because we keep hearing the same chief complaints over and over. I don't feel like myself again. I'm losing my mind. Those chief complaints is what triggers that there may be a hormonal imbalance.
Yeah, absolutely. So we've hit on some of the common and the uncommon symptoms. And I think let's talk a minute about why it's so often misdiagnosed. So I think we can agree that sometimes it's the symptoms are vague and they're kind of across all symptoms. And so connecting the dots, as you said, can be more challenging. But we know that, we've had different studies over the years, and it's a large majority of clinicians who are do not feel well trained. They are not comfortable. Like that's their biggest barrier to providing menopause care is they just simply are not comfortable. It's really not, the individual failure. It's really a systemic failure that even in OBGYN residencies, the average is, 4 hours over the stint of their 4-year residency. Now, I'm grateful that I do recall having about at least 4 hours a year. I will say I don't remember all the details of residency, but at least about 4 hours a year in menopausal care. But the rhetoric then was lowest dose, shortest duration of time for treatment. And nobody was talking about really addressing these symptoms in perimenopause. In perimenopause, it was just give them a birth control pill, for the irregular bleeding. But there's so many options for treatment. I just want patients to feel empowered.
Exactly. And yeah, I agree with you. I think Dr. Rachel Rubin offers, this like early adopter type of
Of course.
culture now where exactly
Yeah.
course where not just OB-GYNs or endocrinologists or urologists are able to prescribe hormone therapy, but also people like myself, primary care providers who are on the front lines. We see it coming into our office daily, and other specialists as well. So I agree with you. I think our healthcare system, it tends to treat symptoms in isolation, right? You have like sleep problems at one visit, mood issues at another, weight changes at a follow-up visit. But at the end of the day, that's why I think women feel unheard. They feel like their symptoms are dismissed, and that's where I think perimenopause often gets missed. And secondly, I think there's no single test, right, from perimenopause. So hormone levels, they fluctuate day to day. Blood tests often come back normal, and this is what's really frustrating for women who know that something's off. And finally, many women as well, they start noticing these changes in their late 30s, early 40s, but they're told that they're too young. for menopause.
Yes.
Right?
So
So
common that they're told they're too young or your labs are normal or it's all in your head. Yes, yes. It's so unfortunate. It's like it's medical gaslighting. It's so unfortunate.
that's a great way to put it. Exactly. And like that's why I founded Eden. It's to create that space where women's experiences are validated, where the symptoms are connected, and that they can finally get answers and treatment. The takeaway from this is perimenopause is often missed, but when you understand it holistically, everything makes sense, and patients can be adequately treated.
Yeah, absolutely. So, and the reason we're talking about this is because it's going to air, this will air in September, and September is Perimenopause Awareness Month. It's all about raising awareness, building community, and sparking change. So, if you're look in your area for any local gatherings, online events, conversations that help shine the light on perimenopause. And you were talking about Dr. Rachel Rubin's course. I also created a course about a year ago, and it has sat it has sat on my computer. So it is coming live to the world. I'm working on getting CME credit. So if you're listening and you are a medical provider or a medical adjacent and you're wanting to learn more about the perimenopause, menopause transition, and how to treat women, this is a great course for you. And it's called Mastering Menopause. So be on the lookout for that. Shoot me an email if you're interested in joining our wait list. I'm offering it once we have the CME available because most people want to get their CME credit, continuing medical education credit.
That is so exciting. And you need to definitely get that started ASAP. There's
I know.
women out there who need treatment.
I know. And yes, shout out to Brooke Stubbs, who is a fabulous internal medicine physician in Austin, who also is boarded in lifestyle medicine. And she's the one who 2 years ago told me, you need to
Shame.
do this, and then asked me to teach her. And she's the reason I created the course. So
God loves
we need to
us.
launch it broader to the world. Okay. Next month, October, we have two events at Sky Women's Health. We have the Susan G. Komen walk on October the 4th. And if you're in the area, you can join our walk team and we'll have a booth at the event. And we also on World Menopause Day, which is October the 18th, we're having a big event at Sky Women's Health. So be on the lookout for that, where you can learn about other providers and services in the area. And we really have some empowering conversation and a lot of fun too. So those are some fun things coming up. Okay, let's talk about health concerns in midlife because we see this a lot. Blood pressure starts creeping up, cholesterol starts creeping up, and they've never had an issue before, insulin resistance. And I always like to remind patients that once postpartum, always postpartum. So if you had preeclampsia, hypertension in pregnancy, if you had gestational diabetes, these things like to present later in life. And so we cannot ignore them.
Correct. I think midlife is a turning point for women's health, and it's such a critical window for long-term health and longevity. As the estrogen declines, we start to see increased risk of cardiovascular disease, bone loss acceleration, leading to osteopenia, osteoporosis if untreated, metabolic changes as well, like you mentioned, weight gain around the midsection, insulin resistance, and furthermore, some early cognitive changes like memory issues. Don't forget your gynecologic cancers and other types of cancers as well. So you do want to get your cancer screening tests like pap smears and colonoscopies performed in midlife. And hormone decline is a factor, but the lifestyle and environmental demands and stressors also contribute. The good news is that this stage is also a window of opportunity, right? With the right care, hormone optimization, strength training, nutrition, gut health, stress management, good sleep, which I'm not getting right now, but we can not only manage our symptoms, but also build a strong foundation for long term health and longevity. So, like, the key takeaway is midlife doesn't have to be a decline, it can be a powerful opportunity to protect your health with the right partner in charge of your health care.
Oh, absolutely. Yes, yes. A little round of applause for that. And you're not getting sleep because you have a 3-month-old.
Correct. Yes.
I'm
I
not
am
getting
pretty
sleep because I'm
postpartum.
closer to 50 than I am to 40. So,
No way.
yeah. So, I mean, you know what? When you talk about this, just thinking you have to suffer through it, I am living proof that you can thrive through perimenopause because I watched my mom suffer through menopause. And, until I got older, I didn't really realize how inadequate her care was. And now I tease that I am the doctor she needed in menopause finally.
Yes.
And so I am very insistent, like, I'm not going down like that, right? And so I started hormone therapy early on the preventative end. And I shared with the audience recently that, I put on 7 pounds of muscle in the last 2 years.
Well, that's amazing.
7 pounds of muscle. So it is possible, ladies. It is absolutely possible. And I'm not working out with any fancy trainer. So So I love to help guide my patients on this whole body health. And so, yes, you were talking about, I would love to get your opinion on this because I get baseline DEXA scans on almost all of my patients, especially by the age of 50. But if there's any family history, if there's any chronic steroid use, if I just have an inkling or a whiff that there might be, so, I really think that we need to be getting these bone density scans so much earlier instead of 65.
I love that you mentioned that because for my panel of patients, I recommended, just like you said, a baseline DEXA scan, which my patients, they do self-pay, right? Because insurance is unlikely to cover it at that early. But I agree with you. Like, why not know your numbers right now, right? That we can prevent osteopenia and osteoporosis. Also, like, for example, even myself, 3 months postpartum, it was Dr. Von der Wright I was listening to, and she mentioned that if in postpartum, if we do not replace our calcium and we don't do strength training, we miss that opportunity. We miss that opportunity to strengthen our bones, right? So it's just so crucial. I think I agree with you that why not get a why not get a DEXA scan early on and know your numbers?
I think it's incredibly empowering just to know because some people are shocked that they have a normal bone density or that they are osteopenic. I mean, I think it's really important to know because the last thing I want are, my patients lifting weights and then they fall and break a hip, you know,
Exactly.
so this is something commonly that I'm starting to see in my practice. And, hello, everyone. We do
Yes.
prescribe GLPs and GIPs. We will help you with your weight management.
Mhm.
Too often, I get concerned that they don't realize that we do that, and they're going somewhere else to get their care. But if we are not working on the nutrition and fueling our body properly, w- we may not be building the muscle or the bone that we want. And so I think that's why it's so important to have that holistic care.
Exactly. And I believe it was on your podcast as well with Dr. Sodi that mentioned it's better to overshoot your protein intake, right? If you're started on a GLP-1. So that way, if it decreases, you have enough reserves, protein reserves, if it's a side effect from your GLP-1s. But at least this way, you're not losing your muscle, which is, crucial. And
Yeah.
if there's one thing I would like every woman listening to know is that you're not alone, you're not broken, you're not losing your mind. Perimenopause and menopause are natural transitions, and with the right support, you can feel strong, balanced, and like yourself again.
Yes. Mic drop. Yes. It's so true. And sometimes it's as simple as getting on proper hormone therapy and patients are then getting adequate sleep and they no longer have hypertension. You
Correct.
know,
Yeah,
I'm
exactly. Yeah, like one baby dose of micronized progesterone, patients tell me within 72 hours, I cannot believe how amazing I feel after getting, so many hours of sleep. It's
yeah.
amazing. Life
Yeah.
changing.
Yeah. Well, you so eloquently just like buttoned up the podcast. But before we do, I want to make sure that we talk about some of the nuances of treatment in perimenopause. So we have to be really careful and consider, do we have sperm in our life? Do we have permanent sterilization on board? And what are our periods doing? So I always say that perimenopause is a little more challenging and a little more nuanced to treat than postmenopause, right? Because we have this pesky period. So some patients are like, oh, I'm not really bothered by my periods. I'm like, right, but you might be if I induce more irregular bleeding or I
Mhm.
induce ovulation, regular ovulation, and now we're having a child at 48 and you weren't expecting that. So we have to take those things into consideration. And so it could be as simple as a progesterone producing IUD or progesterone birth control to manage those cycles, to give you that contraception. And then you can add an estradiol of your choice. Birth control can be an option, but oftentimes doesn't affect those vasomotor symptoms, the hot flushes, the night sweats, etc. And so we just have to take all of that into consideration. But knowing that there are options, I think, is incredibly empowering, and knowing that you're not alone.
Exactly. Yeah, I agree. It's so exciting that now we have so many options available, to our patients that we can offer them for a better quality of life and for long-term health and longevity.
Yes, absolutely. 100%. Well, it's been such a joy chatting with you. Everyone, you need to go follow Dr. Knuppenburg. Her handles are at WholeBody MD on Instagram and Facebook, and her website is wholebody-md.com. Go check her out. If you are in the Florida area, we found you a provider right here. Okay. This is your gal. Go see Dr. Stephanie Knuppenberg. Until next week, be well.